Find all episodes of Community Access at www.helpcarolina.org or subscribe on YouTube. Help Carolina, helping everyone leave poverty so no one walks this journey alone. Hey, I'm Tasha White, and this is Community Access. After the first episode, I got some thoughtful feedback. One question came up again and again. People said, identifying the issue is important, but how do we fix it? And that's a fair question. And they're right. You can't just name the problem and stop there. So today, I want to stay with jobs. But I want to talk about solutions, not just gaps. And I want to be very specific. So first, let's ground ourselves in what's actually happening here in Gaston County. People are working. They're working retail, food service, caregiving, cleaning, stocking shelves, driving. They're working warehouse and entry-level jobs. They're trying all types of new gigs to keep income coming in. And these jobs, they keep the county running. But here's the issue. Many of these jobs pay between $11 and $16 an hour. So let's slow it down. At about $14 an hour, working full-time, someone makes about $2,400 a month. Now they bring home $1,900 a month after taxes, right? So $14 an hour equals $1,900 a month after taxes. Now we got to connect that to the housing piece. And a modest 2-bedroom in Gaston County is about $1,800 a month. So before groceries, gas, childcare, utilities, or health care, your entire paycheck is already spoken for. That's not poor planning. That's math. When your income is already spoken for, you are living one emergency away from falling behind. And the question people ask, which is the right one, is, so what jobs actually pay enough? Because that's what we need to ask. When we talk about jobs that come closer to a housing wage, we are not talking about imaginary careers. We're talking about very real, very specific roles. For example, licensed healthcare roles. This includes jobs like licensed practical nurses or LPNs, registered nurses, certified medical assistants or CMAs, certified nursing assistants or CNAs, respiratory therapists, radiology or imaging technicians, behavioral health clinicians with credentials. These are healthcare jobs that require licensing or certification, and because of that, they tend to offer more stability and higher pay. Then there are the skilled trades. Jobs like electricians, HVAC technicians, plumbers, welders, industrial maintenance technicians, carpenters with advanced skills. These are hands-on jobs. They don't require a 4-year degree, but they do require training, apprenticeships, and experience. We also have advanced manufacturing, and this is not basic assembly line work. We're talking about roles like CNC machine operators, industrial machinists, quality control techs, maintenance mechanics, process technicians, production supervisors. These jobs require precision, technical skill, and training, and they pay differently than entry-level production work. And then there are technical and supervisory roles in logistics and operations. Logistics coordinators, operations supervisors, inventory control managers, supply chain analysts, warehouse operation managers, fleet supervisors. These are roles that keep goods moving, schedules organized, and operations running smoothly. And they usually pay more because they involve responsibility and decision making. These are real jobs, and they exist in our community. But here's the issue. They don't exist at scale in Gaston County the way lower wage jobs do. And that is not because people here are not capable. It is because of how our local economy has been shaped over time. For years, Gaston County leaned heavily on low-wage service work, retail distribution, and entry-level manufacturing, without building strong supported pathways into higher wage roles. And those higher wage jobs require certifications, apprenticeship, employer participation, and upfront investment. And we have not consistently built those systems locally. So people work the jobs that are available, not the jobs that would actually support long-term stability. And that's why telling people just get a better job misses the point. If the jobs aren't here or the pathways into them aren't clear, affordable, and supported, then that advice does not help. So let's talk about what actually does help. I just said it, pathways. Job pathways, not just job postings, right? Training that's tied directly to employers with clear wage outcomes and timelines. That's what I'm talking about. My second suggestion is wage progression, right? Not just starting pay. People need to see how they move from $14 to $18 to $22 an hour and what steps get them there. They need to see that and understand that. Number 3, employer participation. If you've known me, if you've heard me speak, I always talk about public-private partnerships. We need more public-private partnerships because paid apprenticeships and on-the-job training are clear advancement tracks. And then number 4, stability supports during transitions. Of course, I'm a big proponent of surrounding the person with the resources. So we need to figure out a way that people can retrain for a better job and still maintain safe, affordable, stable housing, right? So there needs to be support during the transition. And so for me, this isn't about blaming workers. It's about alignment. And alignment is something communities can choose. Before we close, I want to share how to stay connected to this work. Find all episodes of Community Access at www.helpcarolina.org or subscribe on YouTube. Help Carolina, helping everyone leave poverty so no one walks this journey alone.